Diseases that give a respite from mobilization. What diseases are contraindications for service? When does a conscript get a reprieve from it, and when is he recognized as fit with restrictions? The answers to these questions are spelled out in the Regulations on Military Medical Examination, approved by the decree of the Government of the Russian Federation dated 04.07. 2013 and 565 ed. dated 29.06. 2022 in the section Schedule of Diseases. The Schedule of Diseases provides for the following categories of fitness for military service. A. Fit for military service. B. Fit for military service with minor restrictions. B. Limited fit for military service. G. Temporarily unfit for military service. D. Not fit for military service. If a disease of an organ or system of organs leads to a violation of the function of another organ or system of organs, an expert opinion on the category of fitness for military service is issued according to the relevant articles of the Schedule of Diseases. When examining citizens, in addition to the research methods given in the Schedule of Diseases, it is allowed to use more informative methods. The following abbreviations are used in the Schedule of Diseases. IND. The category of fitness for military service is determined individually. A2, B2, 3, 4 is an indicator of the purpose for military service. Schedule of Diseases. 1. Infectious and parasitic diseases. 2. Neoplasms. 3. Diseases of the blood, hematopoietic organs and individual disorders involving the immune mechanism. 4. Diseases of the endocrine system, eating disorders and metabolic disorders. 5. Mental disorders. 6. Diseases of the nervous system. 7. Diseases of the eye and its auxiliary organs. 8. Diseases of the ear and mastoid process. 9. Diseases of the circulatory system. 10. Respiratory diseases. 11. Diseases of the digestive system. 12. Diseases of the skin and subcutaneous tissue. 13. Diseases of the musculoskeletal system, connective tissue, systemic vasculitis. 14. Diseases of the genitourinary system. 15. Pregnancy, childbirth and the postpartum period. 16. Consequences of injuries, poisoning and other effects of external factors. 17. Other diseases. 14. Pathology of hands and feet. The absence of a leg is always a contraindication for military service. The absence of hands at the level of the wrist joints or metacarpal bones or several fingers is a category of validity D, since the functions of the hands are significantly impaired. But further in the Schedule of Diseases, moderate disorders are called the absence of one hand at the level of the metacarpal bones or wrist joint. The absence of 3 fingers on one hand at the level of the metacarpal phalangeal joints or 4 fingers at the level of the distal ends of the main phalanges, the first and second fingers at the level of the metacarpal phalangeal joints, the first finger at the level of the interphalangeal joints and the second, fifth fingers at the level of the distal ends of the middle phalanges, the first fingers at the level of the metacarpophalangeal joints on both hands and others. Injuries or diseases of the bones, tendons, vessels or nerves of the fingers that have led to the development of persistent contractures in a vicious position are considered to be the absence of a finger. The absence of a finger on the hand should be considered for the first, thumb, finger, the absence of a nail phalanx, for other fingers, the absence of 2 phalanges. The absence of a phalanx at the level of its proximal head is considered the absence of a phalanx. And moderate and minor violations are the category of validity B, suitable with restrictions. They also include people with damage to the structures of the hand and fingers, which does not lead to serious violations of their work. 15. Flat feet. Flat feet and other deformities of the foot become an absolute contraindication for service if it is impossible to use shoes of the established military pattern with them. Those suffering from longitudinal or transverse flat feet of the E degree and people with a missing finger on the foot can serve without restrictions or with minor restrictions, such as the absence of it at the level of the metatarsophalangeal joint, as well as complete reduction or immobility of the finger. Longitudinal or transverse flat foot of the I degree does not prevent the passage of military service at all. All other deformities of the foot expressed in varying degrees make it possible to obtain a category of validity B, limited fit. acquired and congenital deformities of the arms or legs that cause dysfunction and or make it difficult to wear military uniforms, shoes or equipment, for example, X-shaped or O-shaped structure of the legs, axial shortening of the arm or leg, other malformations, diseases and deformities of bones, joints, tendons and muscles are evaluated to establish categories of validity depending on the violation of functions up to complete exemption from service. 16. Chronic kidney diseases. People with chronic kidney diseases are not called up for service if they have been diagnosed with chronic renal failure, CRF, chronic kidney disease with nephrotic syndrome if it persists for 3 months or more, or with its continuously recurrent course, amyloidosis with clinical manifestations of renal dysfunction. CRF with a slight excess of creatinine or persistent arterial hypertension associated with CRF and requiring medication correction, moderate renal dysfunction, and other chronic kidney diseases with minor impairment of their functions allow soldiers with the category limited fit to serve, and officers, fit with minor restrictions. Violation of the urodynamics of the upper urinary tract, hydronephrosis, pyelonephritis, secondary, urolithiasis, other diseases of the kidneys and ureters, cystitis and other diseases of the bladder, non-venereal urethritis, urethral strictures, other diseases of the urethra with significant dysfunction are released from service. The validity category D is also established for people with one kidney, with nephroptosis, omission, of both kidneys of stage IE, polycystic kidney disease, renal vascular anomaly and other diseases. There are no absolutely fit for service among those suffering from kidney diseases, but there are fit with minor restrictions. This category is received by those suffering from mild forms of urolithiasis, unilateral or bilateral nephroptosis of stage I, unilateral nephroptosis of stage E and other diseases without violation of the excretory function of the kidney. When conscripted for military service, military training, a person is recognized as temporarily unfit for it for 12 months if pathological changes in urine persist after suffering acute inflammatory kidney disease. 17. Diseases of the male genitals. Diseases of the male genital organs, including congenital, in the schedule of diseases include benign hyperplasia, inflammatory and other diseases of the prostate gland, dropsy of the testicle, orchitis and epididymitis, excess foreskin, phimosis and paraphimosis, etc. The validity category D is established if a man suffers from benign prostatic hyperplasia of stage IE with a significant violation of urination with unsatisfactory results of treatment or refusal of it, or he does not have a penis proximal to the level of the coronal sulcus. Men who have been diagnosed with dropsy of the testicle or spermatic cord with a fluid volume of less than 100 ml, phimosis and other diseases of the male genital organs with minor clinical manifestations. Retention of one testicle in the inguinal canal or at its external opening. Chronic prostatitis with rare exacerbations are recognized as suitable with minor restrictions or without them. The remaining male diseases with moderate or insignificant manifestation of function are recognized as the reason for the establishment of Category B, limited fit. Diseases of the female genital organs. The ban on military service. The category of validity D is established if a woman suffers from chronic inflammatory diseases of the female genital organs with pronounced clinical manifestations and exacerbations, 3 or more times a year, requiring treatment in a hospital setting. Diseases with moderate clinical manifestations, exacerbations 1-2 times a year, requiring treatment in inpatient conditions, give the right to service with restrictions, the category of fitness in, and with minor clinical manifestations and rare exacerbations that do not require treatment in hospital conditions, they give a woman the opportunity to serve with the category of fitness B. Endometriosis becomes a direct contraindication for the service if surgical treatment is required. When it is carried up successfully, a woman can serve with the category of validity B, as well as those with moderate endometriosis and amenable to conservative treatment. With the category of validity B are those who have manifestations of this disease are not burdensome. Those suffering from non-inflammatory diseases of the female genital organs, including congenital, can receive either category D, not fit, or B, limited fit. In the first case, these are women with complete or incomplete prolapse of the uterus or the dome of the vagina, with various forms of urinary incontinence, fistulas involving the genitals with unsatisfactory results of treatment or refusal of it. Admission to service with restrictions of those suffering from mild or moderate genital prolapse, urinary incontinence, fistulas, and other pathologies depends on their clinical manifestations. As for disorders of ovarian menstrual function, only women with uterine bleeding leading to anemia receive Category D, and such diagnoses as sexual infantilism with satisfactory overall development and infertility allow you to serve without restrictions, with the category of fitness A. Pregnancy, the postpartum period and their complications, as well as temporary functional disorders of the genitourinary system after an acute illness, exacerbation of a chronic disease or surgical treatment give the right to delay.